The choice of the appropriate type of anesthesia for your procedure is based on a couple of things. The first thing that I look at is overall health history. So that's the most important thing. Patients who are very unhealthy may not even be appropriate candidates to have any surgery being done. So that's the first little check off on the checklist. The next main thing that I look at is what procedure are we doing? For example, if we're doing a rhinoplasty, that has to be done under general anesthesia. There really isn't another option. I really cannot get you comfortable enough and do it safely under local anesthesia or local anesthesia with oral sedation. So that's a big factor as well in the type of anesthesia that we use. Now, let's talk specifically about facial rejuvenation procedures. I break facial rejuvenation procedures into two categories. Simple procedures. Simple procedures include an upper blepharoplasty, maybe a chin augmentation. In some select patients, maybe a brow lift or fat transfer. These types of procedures, patients tolerate very well under plain local anesthesia. So you can inject the surgical site, kind of talk the patient through it. Once they're numb, they don't feel anything, and you can do surgery very easily. Now, all the other procedures, so for example, facelifts and most fat transfers, most brow lifts, patients elect to either undergo local anesthesia with oral sedation or general anesthesia. I'm going to kind of cut all of the false information. I know that there's a lot of stuff out there where doctors tell patients, oh, we're gonna do local anesthesia because it's safer, why do you want to go to sleep? All of that is absolute garbage. The safety profile of local anesthesia with oral sedation or general anesthesia is exactly the same. If there was one that was safer than the other, we should be doing that every single time. So the safety is not a variable that I use in making that decision. First thing, to do local anesthesia with oral sedation, I need a patient that is motivated, okay? I'm not going to lie, so the point at which I'm numbing the patient up, there is some discomfort on the patient's side. We're giving you a lot of medications to minimize that discomfort, but there is some that exists. So patients that are extremely squeamish, extremely anxious, have a history of panic attacks, so on and so forth, they are not good candidates for local anesthesia with oral sedation. The goal of the procedure is to do the procedure in the safest, most convenient way possible. The advantages of doing it with local anesthesia with oral sedation is I find that patients recover quicker, less bruising and swelling, less bleeding, so there are advantages, and we have to throw this out there, it is cheaper. However, the cost of the procedure is not the determining factor. Everything else is. So if I get a patient who's extremely nervous, says, hey, I don't want to feel anything whatsoever, I'm going to recommend general anesthesia to that patient. Because the worst thing that I want a patient to feel is that we are forcing them to do local anesthesia just because of the cost aspect of things, and they are really feeling uncomfortable doing it. That is not a win-win situation for the patient or the surgeon. So these are some of the characteristics and criteria that I use to figure out which type of patient is ideal for which type of anesthesia. Most of our facial rejuvenation procedures, probably greater than 95%, are done in women. Women tend to have a much higher pain threshold than men do, and hence most of our facial rejuvenation procedures are done under local anesthesia with oral sedation. The vast majority of facelifts and facial rejuvenation done in men are done under general anesthesia. So this is just a brief primer on the choices of anesthetic type for facelifts and facial rejuvenation. However, I would be able to give you much more information after a detailed consultation.